Hello everyone. We will continue the series of solving previous year question papers. So in Jan 2025, paper 1 of general medicine, second question was asked about mention the drugs which will lead to withdrawal effects. So drugs leading to withdrawal effect. And they have asked, along with listing it out, we have to mention the symptoms for those drugs and how to manage. So this is a very vague question because they have not specified which drug withdrawal. So in such cases, we have to be mentioning the answer precisely so that we will not waste excess time in one or two drugs only. So what we will do is, we will first list out the substances or drugs which will lead to withdrawal effect. So we can divide these things into drugs and substances and other substances. So in drugs, we can mention opioids, benzodiazepines, barbiturates, and some antipsychotic medication, mainly SSRIs. So these are some drugs. Coming to substances, here all of you might be probably guessing. These mainly include alcohol, nicotine, even cannabis. In other substances list, we can mention some rarely used medications which can cause withdrawal effect. For example, drugs used for insomnia, mainly zolpidem, and some other things. So here almost we have listed out some 8 drugs so that we can mention the symptoms and how to manage these in short to cover for 10 marks. So we'll deal one by one. Main thing in the second part of the question is about the symptoms seen during the withdrawal state. So as we know, any individual, if is being dependent on some substances or drugs, to imagine easily, suppose an individual is addicted or completely dependent upon caffeine, coffee or tea. So when we suddenly withdraw or when they don't get the required substance, whatever the features will occur in the body will be the manifestations of the withdrawal of that particular substance. So you can imagine that commonly in symptoms, you can just imagine when we are not getting coffee or tea, just for example I am saying, so there will be desire to get the substance, so it will be cravings will be there for any substance in general. Then usually we will feel discomfort, so some physical discomfort will be there, physical discomfort. For example, some might get headache, fatigue, nausea, etc. And few will get mood changes also, commonly irritability, anxiety, restlessness, even difficulty to focus, difficulty in concentrating. These will be the mood changes. Then the individual will also get difficulty in sleeping, so sleep disturbances. For example, insomnia for many. Some might even get some vivid dreams or lack of fresh feel even after sleep. So these will be the common symptoms seen in any substance withdrawal which is causing dependency. So these things we can mention to each of the things which we mentioned in the first. And coming to some particular features, mainly you know that alcohol, in case of alcohol withdrawal, there might be, even it can go to the extent to cause hallucinations. sometimes this alcohol withdrawal, if it is too severe, it can also lead to seizures. This you might be knowing. And in some medications, there might be weight changes also, weight gain or weight loss. And the other things like cravings, mood changes, irritability, physical discomfort, and sleep disturbances will apply to all other substances and medications. So that is about symptoms. Coming to the management. So in management, we have to focus on few things. So coming to treatment proper. See, the individual is now dependent and he is in withdrawal state. So it should not be like we should guide the individual to stop the substance or drug immediately, because it will lead to adverse effects, which are nothing but withdrawal effects, and some of the symptoms are very severe, as we just now discussed. So it is very important to gradually and safely detoxify that substance from the body. So you have to remember that safe, gradual detoxification is important. Then when we are doing this gradual tapering, there might be appearance of some withdrawal effect. So to manage that, we have to focus on managing withdrawal symptoms. And for some, these two steps will be succeeded very well. But the thing is, after stopping the particular drug or substance, there might be again relapse or craving again. So to prevent relapse, we have to use some medications. So this is all about medical management. All this will be medical thing, where we can use some medications. Along with this, it is very important to consider psychological support through counselings and even cognitive behavioral therapy, and we need to give social support also for such individuals. So this is the general management of any drug withdrawal or drug dependency treatment. So if we want to focus on medical management only, we know that, for example, for opioids, to gradually taper it off, we will use a long-acting opioid first. Long-acting opioid should be used. Then to manage the withdrawal effects, we will use clonidine. Second one is clonidine is the drug of choice for withdrawal symptoms. Then to prevent relapse, we will use naltrexone. This is the medication which we use. Coming to alcohol, here mainly we will be focusing on managing withdrawal symptoms using benzodiazepines. And to prevent relapse, there are some medications like acamprosate. Things to remember is, we have to use the drugs to prevent relapse only after the cessation, complete cessation, and a safe detoxification process. Similarly, you know some medications for nicotine dependency. Here we will use gums, patches or lozenges. So that will lead to gradual tapering of the nicotine. Gum, patches, all these things we will use. Then there are some medications to manage withdrawal symptoms as well as relapse. For example, varenicline, bupropion. This is general and a overview about the second question, that is drugs leading to withdrawal effect. So here to summarize, we listed out the medications into three major groups like drugs proper, some substances, and other rare substances. Then we focused what will be the withdrawal effect in general. So in that, just to revise, craving, sleep disturbance, mood irritability, and some physical discomfort, and some things very specific to a particular drug like hallucinations and withdrawal seizures in case of alcohol dependency. Then we focused upon treatment mainly into three sections. One is medical management, then psychological support, and social support. So in medical management, again, we should do it in three sections. For example, safe and gradual detoxification through gradual tapering of the substance or drug. Then during that process, if any withdrawal symptoms are there, we have to focus on managing that withdrawals. Then once the substance is being withdrawn successfully, we have to prevent relapse, that is reuse of that particular substance. So this is the second question of Jan 2025 General Medicine paper 1. I hope this series is helpful for exam going students and in general for other medical students also, because we are dealing short points as well as the understanding of the particular matter. Hope it helps. Please share with your friends as much as possible and do subscribe to our channel. We'll see you in the next question as next video. Thank you.